Low molecular weight heparin. Low molecular weight heparin is an anticoagulant used to reduce the coagulation. Let me discuss in detail about that. Contents. It includes definition, mechanism of action, pharmacological action, pharmacokinetics, adverse effects, contraindications, and advantages. Advantages over the unfractionated heparin or heparin and uses. Let me see the definition. Low molecular weight heparin, in a short form, usually it is called as a LMWH, is an in vivo anticoagulant used to prevent the coagulation. Let me discuss about the mechanism of action. Low molecular weight heparin binds the antithrombin 3. So this antithrombin 3 is naturally occurring protein usually involved in a reducing the coagulation, means it acts as an anticoagulant. So this antithrombin 3, after binding with the low molecular weight heparin, it will activate and it inhibits the coagulation factor 10A. So due to inhibition of coagulation factor 10A, there is the inhibition of conversion of prothrombin into thrombin. So this thrombin is required to formation of the fibrin. Means fibrin is nothing but formation of thread-like structure in a clot formation. So formation of thread-like structure is the final step of clot formation. So due to inhibition of conversion of prothrombin into thrombin, there is no formation of fibrin, so that it prevents the coagulation. Let me discuss about the pharmacological action. It has action on blood, means by binding the antithrombin 3, it inhibits the conversion of prothrombin into thrombin and reduces the coagulation. Pharmacokinetics. So usually this low molecular weight heparin is administered at the parenteral route. It is metabolized in the liver and excreted through urine. Adverse effects. It causes hypersensitivity reactions like redness and irritation. You can see in the pic how it will be the redness and bruising. Bruising means under the skin, so it causes the damage of the very small blood vessels, so that it causes some bluish color of the skin, and also it causes osteoporosis due to loss of bone strength, because it um, reduces the calcium and phosphate in a bone, and also it increases the liver enzymes, and it causes uncontrolled bleeding in case of bleeding disorder. Means if the person have hemophilia, if we administered low molecular weight heparin, it increases the bleeding or excessive bleeding. Contraindications. So when we should avoid this low molecular weight heparin in case of bleeding disorder, because just now we discussed, if the person have a bleeding disorder, if you administer low molecular weight heparin, again there is a chances of excessive bleeding, because low molecular weight heparin acts as a anticoagulant, so it reduces the coagulation. And we should avoid in case of thrombocytopenia. If the person have thrombocytopenia, thrombocytopenia is the condition where the platelet count is low. The platelet action is to reduce the coagulation. So due at the in thrombocytopenia condition, the person, due to low platelet count, there is a difficulty in formation of clot in the blood. If we administer low molecular weight heparin, again this also may cause the excessive bleeding. And also we should avoid in case of severe renal disorder. So why we should avoid in case of severe renal disorder means it may cause over anticoagulation and serious bleeding complications in a severe renal disorder. So that to reduce the bleeding complications we should avoid. And also we should avoid in case of severe liver disease. So why we should avoid in case of severe liver disease means usually it causes a side effect of elevated liver enzymes, so it increases the enzymes level in a liver. If the person is not functioning properly, it has a severe liver disease. In that condition, if we administer low molecular weight heparin, it may cause the increase in the levels of enzymes, and it may cause dysfunction of the liver, so that we should avoid. And also we should avoid in case of uncontrolled hypertension. So in the uncontrolled hypertension is very difficult to control the blood pressure. In that condition, if we give an low molecular weight heparin, it may increases the risk of bleeding, so that we should avoid in case of uncontrolled hypertension. Advantages over the heparin. So this low molecular weight heparin has a longer duration of action than the heparin, and this low molecular weight heparin activity is more predictable than unfractionated heparin. Self-administration is possible for low molecular weight heparin, and there is no regular blood checkup is required for the low molecular weight heparin. But in case of heparin, regular blood monitoring is required. Uses. It is used in a venous thromboembolism, pulmonary embolism, myocardial infarction, and unstable angina to reduce the coagulation. Thank you.